I'm Lucy Nalpathanchel. The Wheelhouse will be back next week. Today we feature a special from Connecticut Public Radio called First Wave. As Connecticut emerges from the first wave of the coronavirus pandemic, hosts Diane Orson and John Henry Smith analyze the state's response, from the waiting period before the first positive test to the reopening of the economy. With officials warning of a future wave, Connecticut Public Radio takes time to revisit what happened through archived tape and new interviews with those who directed the response. What worked? What didn't? And how will this inform the state's handling of the next wave?
Last year, roughly 7,400 miles away from Connecticut, a novel coronavirus emerged in Wuhan, China. 142 days ago, the first case was confirmed in Washington state.
And it's been just 94 days since the first Connecticut resident was confirmed to have COVID-19. In that time, more than 4,000 Connecticut residents have died, more than 44,000 have tested positive, more than 500,000 people have filed for unemployment, a protest movement has taken to the streets, and everyone's world has completely changed.
And although the pandemic has been on the decline in Connecticut since mid-April, it's far from over. I'm Diane Orson.
And I'm John Henry Smith. Over the next 2 hours, we'll look back at where we've been, what worked, what didn't, and what's next. This is First Wave.
In the middle of January, college students returned to campus for the spring semester. They came from all over the world. One of those students was returning to Wesleyan University in Middletown. The student developed a cough and fever, and as it turns out, had traveled through an airport where another person was confirmed to have the disease caused by the novel coronavirus. At that point, the disease we now know as COVID-19 didn't even have a name.
It was more than a month away from being declared a pandemic. Just 5 cases were confirmed in the U.S. at the time, all on the West Coast. But Dr. Anthony Fauci, director of the National Institute of Allergy and Infectious Diseases, told NPR that more would likely come.
I would not be surprised at all if we start seeing more in the coming days to weeks.
Out of an abundance of caution, that Wesleyan student was tested and monitored. The test came back negative. Over the next 6 weeks, others who traveled and may have been exposed to the coronavirus were tested, quarantined, and monitored, but no one tested positive.
A month later, samples were being tested in-state, and by March 6th, 42 tests were conducted. All were negative.
But at this point, anxiety was already on the rise, and xenophobia emerged as Asian Americans in Connecticut were confronted with racist attacks because of the virus's origins in China. Attorney General William Tong spoke about the incident in his hometown of Stamford on Connecticut Public Radio's Where We Live.
A Chinese-American woman who's been in this country for decades was checking out at a grocery store, and the grocery store clerk asked her, when was the last time you went to China? Are you from China? And as she was trying to answer the questions politely, the clerk grabbed a spray bottle of disinfectant and sprayed her and her groceries.
18 miles away from Stamford in New Rochelle, New York, the virus was quickly spreading. A lawyer fell ill in late February, and authorities eventually created a 1-mile containment zone after it was clear that community transmission was occurring with more than 100 cases. That zone included the use of National Guard troops. Lisa Keller, a New Rochelle resident, described the feelings inside the containment zone to WNYC.
Since this happened a week ago, people were saying, why did they take a week to start this or do anything? And the most frightening part, again, was the National Guard. What are they going to do?
It was clear that if the virus wasn't already in Connecticut, it would be soon. Cases were confirmed in all the surrounding states. Meanwhile, the state was still open. Metro North was still running, including the New Haven line that runs through New Rochelle.
Then on March 6th and 7th, 2 New York residents who worked at Connecticut hospitals tested positive.
At this point, panic buying was underway. Store shelves normally stocked with things like toilet paper, disinfecting wipes, and hand sanitizer were bare.
But still, at this point, no Connecticut resident had tested positive. On the morning of Sunday, March 8th, Senator Chris Murphy gave his assessment of the situation on CBS.
I imagine we have hundreds, if not thousands, of cases in my state. I think we have no concept of the scope of this epidemic yet because we have not been able to test.
And later that day, it happened.
Hello, I'm Chris Tillett. I'm the first confirmed case of COVID in the state of Connecticut.
The Wilton man contracted the coronavirus while at a conference in California.
When I knew I had it in San Francisco, I would say it hit me like a ton of bricks. You know, I was finishing up a demonstration on a show floor, and I just walked off and went back to my hotel room. I felt awful. Every part of me hurt. I finally understand that expression, I got hit with a ton of bricks. That's how I felt. Just the compression everywhere, your fingers hurt, your toes hurt. It was miserable. It was absolutely miserable.
How tough was it to get tested?
I begged for over a week. The problem is they didn't have enough tests. The state of Connecticut was still dispersing them. So I was treated like I had the flu. I've had the flu. I've even had swine flu. So see, I only get pandemics. That's the only kind of flus that catch me. But I had swine flu. I knew that this was different. This was unique.
Did you think you were going to die?
Yes. I did a couple of times. When you kind of face that and you think, well, this could be it, you do have a certain piece to say, well, I'm fighting as much as I can, and I've done the best I can. And then you just go, well, let me hang in for a little bit longer. Let me hang in. I kept a positive attitude, but yes, I did feel a couple of times like this was the end.
The conference you went to in San Francisco, I assume you were going out there for work. Have you replayed the decision-making process? Because I know it probably wasn't only you. It was probably, hey, the company probably was in favor of you going out there as well. Have you replayed the decision-making process about going out to this conference? How have the discussions been with your superiors since that episode?
Yeah, they were very upset that I got this. My boss, he felt awful. He just kept replaying in his head. I actually asked not to go the week before. And my boss is like, look, we got everything set up. So yes, my superiors all felt awful. I think in society we look back too much and we want to assign blame and we want to, if it wasn't me, it would have been somebody else. So the way I look at it is I got it. Yep, I got it for work. My CEO was awesome. My HR department called or texted my wife every day. My CEO covered all of my medical expenses personally. He paid whatever deductible we had. He paid that out of his pocket.
That's Chris Tillett. He was the first Connecticut resident to test positive for COVID-19 more than 3 months ago. He spent 10 days in the hospital and is now back at work. One of the questions we're asking is when the pandemic became real. For Chris, it didn't become real for him until after he was already sick.
Getting on the plane coming home from San Francisco, looking over and at everybody that's sitting beside me on the plane, not knowing if I'm giving this to other people. There was a baby in the row beside me. I felt so awful to be on that plane, and I felt awful.
Diane, that has got to be one of the most terrifying and guilt-inducing experiences, especially because it's so easy to get sick when traveling. And it's worth noting that the pandemic didn't become real for Chris until after he was feeling sick. So, Diane, when did the pandemic become real for you?
Well, several things happened within a few days of each other, making the pandemic very real for me. First, I got a call that our New Haven bureau was going to shut down. So that afternoon, I went racing over to pick up as many pieces of remote recording equipment as I could. I also work a lot as a musician, and rehearsals and concerts started to be canceled. But I think the most important or profound thing that made me feel this was very real is that I'm the parent of 2 adult children. One lives in Washington, D.C., and one lives overseas. And we're quite a close family, and we had some really tough conversations about what this would mean. Both of our kids chose to shelter in place correctly, I think so, but it was really hard for me at first to accept that I wouldn't be seeing them in person for quite a long time. But I'm just so glad that we have video and phone chats. It's just not the same. How about you?
Well, being an old sportscaster, the real eye-opener for me was the Connecticut Interscholastic Athletic Conference led by Glenn Lungarini when he came out and made the move to shut down the winter sports playoffs it immediately dawned on me that this was not going to be a short-term thing. And then, you talked about I know that you have kids and you talk about yours. I mean, it certainly became realer for me when we really had to sit down, my wife and I, and discuss what were we going to do with our daughter. Were we going to wait for the school to make the decision to cancel school? But she was out of school at least 2 days before the school made the final decision to cancel everything. And in fact, the school sent us a note saying, hey, we noticed Isabella wasn't in school today. And I sent them a long note saying, I think this is going south quickly and you all need to really consider closing up. And then I don't think they did it because of me, but I think that, of course, a couple of days later, they actually did.
This is First Wave, Coronavirus in Connecticut, a special from Connecticut Public Radio. I'm Diane Orsen.
And I'm John Henry Smith. Once COVID-19 was clinically confirmed to be in Connecticut, public officials turned to a mitigation strategy. Governor Ned Lamont declared civil preparedness and public health emergencies on March 10th, and then, just a day later,
the World Health Organization has declared the coronavirus outbreak a pandemic.
The state of Connecticut was beginning to shut down, although at the time many decisions were left to local officials, including the closure of schools. Here's State Education Commissioner Miguel Cardona.
The decision to close buildings and which buildings to close are based locally at this point and with the direction of the local DPH.
One district, Region 14 in Bethlehem and Woodbury, closed all buildings for cleaning on March 10th after a student was exposed. New Haven Public Schools closed 3 days later after the guardian of a student had come into contact with the virus and had been in the building.
Less than a week after Region 14 closed, all public schools in Connecticut would follow suit and move to online classes. And that's how the school year will end, online. Later this hour, we'll hear from students and teachers about the new reality of distance learning and the impact it had on them.
Now, the same week that public schools closed, the governor also ordered all non-essential businesses to close and told restaurants they must move to takeout-only service, setting in motion the greatest economic crisis the state has faced in living memory.
Then on March 17th, St. Patrick's Day, Connecticut's two tribal casinos, Foxwoods and Mohegan Sun, agreed to close their doors for the first time since they opened in the early 90s. They didn't have to. Both operate on sovereign land and are not subject to state orders, but close they did. These two entertainment meccas, which stayed open through 9/11 and Hurricane Sandy, 24 hours a day, 7 days a week, went dark. Connecticut Mirror reporter Mark Pasniokis was at Foxwoods the night they shut down.
The atmosphere was unique. I'm not a gambler, but I've been to a fair number of casinos in my life. And, there is always that incredible energy running through those places all times of the day and night. And you walked past, parts of the casino that were empty. They were dark. The only illumination was some of the slots machines. But to walk in was eerie, and that was what the longtime casino employees said over and over again. They would just look around and couldn't believe it. Rodney Butler, the tribal chairman of the Mashantucket Pequots, had really grown up there professionally. After graduating from the University of Connecticut, he took a job as a financial analyst, and he would be there all times of the day and night. And there was this one long corridor that led to the original gambling floor. And he just stopped and he stared and he took out his phone and he took a picture. And he just said, I've never seen this. Even at 4:00 in the morning, when he used to pick up the slots receipts, it would be packed. And in an odd little way, it was a moving moment, But the soundtrack was still playing. There was endless music overhead, and I just noticed that it was Donna Summers playing The Last Dance, and I mentioned it to Rodney Butler, and the look on his face was priceless. And he just said, oh my God, every end of wedding song. And it was really perfect. It just captured this moment. It's like, okay, folks, drink up. It's time to go home.
So let's dance, let's dance, let's dance, let's dance, let's dance, let's dance tonight.
With the casinos closed, most employees were furloughed, roughly 10,000 people, contributing to a wave of eventually hundreds of thousands of unemployment claims around the state. But while many were laid off, other workers across various industries were deemed to be essential, and they weren't just first responders or medical staff.
And for those thousands of essential workers throughout the state, working from home was never an option. As Connecticut Public Radio's Ryan Lindsay reports, bus drivers, grocery store, and healthcare workers have had no choice but to risk contracting COVID-19 while working through the pandemic.
Joe Jarmy remembers buying groceries for the first time during the pandemic.
I went shopping that first week just to get some stuff for myself. And basically, the person next to me was spending like $675, where I was spending $100.
That was back in March. Jarmy is a meat cutter at Stop and Shop in Madison.
The wealthier areas actually got hit first. And then when people started getting their paychecks and stuff, for 5 days in a row, we had completely empty meat cases. We had nothing to sell.
He said it was like people were shopping for a snowstorm again and again. Since then, things have slowed down a little bit. But Jarmy says many customers still don't fully respect social distancing rules, which puts his health at risk.
They come right up to you. They tap you on the back, stuff like that. They just don't get it.
In a time of mass unemployment, workers who remained on the job might seem fortunate. But being deemed essential carries the risk of infection, and along with it, other struggles. While Stop and Shop offered 10% hazard pay to its employees, other companies did not bump wages. Essential workers fought a months-long battle with the state for automatic access to workers' comp payments, which remains unresolved. And then there was protective equipment. When the pandemic started, Jarmy said they didn't have any PPE. Now, Stop and Shop provides masks for employees.
They give you a mask every week. You get a clean one. Because I work in the meat department, they've been giving me one extra mask because it gets wet and, you get meat on it and so on and so forth. It's not the best place to be wearing a mask, to be honest with you, because it's cold, it's damp, it's wet.
For some essential workers, the fear of infection became a reality. Willie Medina has been a bus driver with Norwalk Transit for 12 years, but since contracting COVID-19, he says he's considering leaving bus driving behind.
The new normal, because we're never going to get back to normal, but the new normal, it's very daunting. It's very, there's so many uncertainties that you don't know what's going to happen. These people are taking their early retirement, so now I'm going to be most likely in a position to be more out there with the public.
For frontline healthcare workers, a lack of PPE has been particularly alarming. Martha Marks works as a visiting nurse in New London. Marks spoke during a virtual roundtable with unionized healthcare workers in early April.
Being a healthcare worker in home care has been hell for the last month. We are not flattening the curve. A month ago, we were not allowed to wear masks in the homes because we didn't want to scare the community.
And Marks is still fired up. She says while masks have become the new normal, she still worries about being in close contact with her patients who are 70 and older.
Best practice is not using the same mask all day long and then throwing it away. Every surgical mask is supposed to be used, one mask, one person. We continue to have to use the mask for multiple patient surgical masks. Our N95s, when we have COVID positive patients, this is both in the hospital and in home care, we then save it for next time we see that patient.
Mark says she's upset that her employer isn't offering to test nurses every week or every other week.
I'm nervous, I'm scared. I do everything I'm supposed to do. We bleach everything. I wipe the doorknobs off. When I have a COVID positive patient, they're the end of the day. I come home, I strip down, I shower, I cut my hair short. So I'm doing everything as perfectly as I can.
She says the coronavirus has changed how she feels about her job.
For 35 years, I've been a nurse, and all I have done is take care of my patients. And I was then starting every single day with the fear that I was going to cause harm to my patients. I love being a nurse, and the pandemic became real for me when I no longer loved my profession.
Throughout this wave of the pandemic, essential workers have been regularly hailed as heroes. But for many, that sentiment hasn't been backed up by adequate action to keep them safe, either physically or financially, on the job. Ryan Lindsay, Connecticut Public Radio.
Throughout this special, we'll be remembering some of the more than 4,000 Connecticut residents who have died from the coronavirus. We'll start with Laura Gansey, who remembers her father, 74-year-old Michael Gansey of Newington.
My mom got sick. I knew it was bad because I would call and she couldn't talk, and my dad was taking care of her. And that's just like very unusual. I got my dad on the phone and he was like out of breath, and he was saying he had just cleaned up the bathroom, and I was like, Dad, please put a mask on. And then my dad was rushed to the hospital on Monday. Thursday, she texted that he picked up his phone, but he couldn't speak because he was having a coughing fit. He was intubated later that day. My last text from him was the 18th, and it just said, got corona. And I just wrote this whole thing about, like, I love you, and he just wrote back, love you. And that's the last text that I got from him. So he began to decline. His doctor was extremely warm. He called each one of us, and we were able to say goodbye through his cell phone that he had in a plastic bag on speakerphone.
That was Laura Gansey, remembering her father, Michael Gansey of Newington. You're listening to First Wave Coronavirus in Connecticut. Coming up, the economic toll of the pandemic and the damage in the state's nursing homes and prisons. We'll be back after this break. This is First Wave, Coronavirus in Connecticut. I'm Diane Orsen.
And I'm John Henry Smith. The public health emergency caused by the coronavirus pandemic has been massive worldwide, and in turn, so has the economic crisis.
I think the economy has been put effectively into a medically induced coma.
That's the editor-in-chief of The Economist, Zanny Minton-Beddoes, speaking on the Marketplace Morning Report. She was talking about the global economy, but Connecticut was doing the same thing.
So far, more than 600,000 unemployment claims have been filed during the pandemic. Nearly every corner of the economy was hit hard, but the worst impact has been in the leisure and hospitality sector. That includes the restaurant industry, which had to rely on takeout and delivery service for 2 months, something that not every restaurant was equipped for. Phil Barnett is co-owner of the Hartford Restaurant Group.
Our business is built with on-premise, which would be consuming, the products within our establishment. We're losing right now about, 80% of our revenue that our staff members depend on, as well as we employ many staff members to work within the on-premise aspect of the business, whether you're a server, whether you're a bartender, a host. So yeah, it's unfortunately, the reality is here, and it puts us in a really tough position right now.
Well, it was a tough position indeed for Phil Barnett's restaurants, which include Wood and Tap, and it was a tough situation for restaurant employees across the state.
My name is Brooke Burlett. I reside in Glastonbury, Connecticut, and I am still employed from Ted's Montana Grill. I worked at the Hartford location on Front Street. I was furloughed at the beginning of this pandemic, and currently I am still furloughed and not working. I fortunately have been able to claim unemployment. I did have to spend quite a few hours calling and recalling back to the Department of Labor because I needed to get in touch with an actual person who worked there. There is no sitting on hold option. You have to call, hang up, call, hang up, call, hang up. I compared it to when I was younger and was trying to win concert tickets from a radio station of just incessantly hanging up and calling back, and it ended up working.
While the restaurant industry was among those hardest hit, no sector was spared.
So my name is Maria Cardona, and I was working at the Phoenix building in downtown Hartford. Just cleaned offices. I thought I was only going to be out for like 2 weeks till we were able to go to another building. But then this happened out of nowhere. And then they're like, okay, you guys are also stopping. You guys are not working here no more, but you guys can't go nowhere else either. I have my 2-year-old son that needs insurance, and right now I have to take him to the doctor. And he was also supposed to go for his 2-year physical, but with no insurance, I can't bring him.
My name is Randall Van Cole. I'm a security officer at the Hartford Insurance Company. They closed the building down, so, without any employees, there's no need for me to provide a service. It was kind of difficult. It was very difficult. I was 7 weeks without unemployment. I mean, when you have the rug taken from underneath you with no recourse, it's difficult. It's just took me way off track. And as a result of that, I had to really, really watch every cent that I bought in, but I survived.
Randall Van Cole was one of more than 500,000 Connecticut residents who filed for unemployment benefits since the start of the pandemic. And filing for unemployment requires resources to process those claims. Some of those resources at the State Department of Labor, the computer systems, were 40 years old, far too brittle to handle this surge. And joining me now to discuss the challenges of meeting that need are Labor Commissioner Kurt Westby and Deputy Commissioner Dante Bartolomeo. Thanks for your time.
Thank you for having us.
As the governor began to announce business closures in the middle of March, did you have any idea of the tidal wave of claims you'd be facing?
We knew there would be a lot more, but I don't think anyone had any idea of the tsunami of claims that would be coming. Not only the absolute numbers of claims, but the rapidity at which those claims came. We've never had anything like that at DOL. Even in the last Great Recession, there were about 10,000 claims a week. We're talking at the peak here, many, many more claims by a factor of 6 or 7 per week.
And how does that compare to like a normal year?
It just blows it out of the water. We've had, in less than 3 months, over 4 years of normal, what we would call normal claim activity.
And I understand the department was pretty lean in terms of staff as you went into this crisis?
We've, over the years, been defunded by the federal government. We actually went through layoffs in 2015. We've reduced the employment levels at DOL since then because we simply could not afford it. Over the last 4 years, we've incurred in most of those areas of UI staff decreases of 50%. A lot of our staff have been working 14-hour days since March 13th. It's been a staggering piece of work.
The staff, as the commissioner mentioned, are working around the clock, and literally have been since March 13th when all of this began. And, they want to be doing that because the folks that we serve, they're their neighbors, their community members, their families. This is hitting everywhere. It doesn't discriminate, and so that's been something that we've been incredibly proud of the dedication.
I know that you've had another challenge. Your computer system was pretty antiquated.
There was many, many years, at least a decade, where we had been trying to get an improvement, a modernization in our old computer system because we knew that the COBOL-based 40-year-old system would not last very long. But unfortunately, in the economy since the Great Recession, there have been so many other priorities. So whether it's mental health services or education and all of these things, school safety, that are very, very important, it were competing priorities for funding. So the Department of Labor computer system until now hadn't necessarily been seen as a priority, but now we are a lifeline to people. We are their safety net.
We have heard many, many, many stories of people having to wait weeks to have their claims processed or spending hours on the phone. What do you say to those people?
Try to be patient. I know it's difficult. We've shifted 40 people from other positions to try to help out with the calls, with our email system. That has helped, but it has not been enough. We're talking just tens of thousands of calls and emails coming in every day. We urge folks to be patient. We are bringing on 20 more staffers to deal with calls, and are going to be bringing on increments of 20 after that, as well as standing up a state-of-the-art call center to deal with that problem also.
So honestly, can you say things are getting better?
I can say things are getting better with a caveat. For those who are still waiting, things are not getting better, but we are getting to them very fast.
We've already seen our unemployment rate go from, the mid 3-point-something% up to about 18% last I knew. So in addition to the federal extended, we now have our regular quote unquote state extended benefits and possibly even high extended. So there is an indicator that we're talking with at least those programs covering people until the end of the year potentially, which tells me that it's not going to wrap up too quickly.
Well, that's all we have time for now. Labor Commissioner Kurt Westby and Deputy Commissioner Dante Bartolomeo, thanks for talking.
Thank you. It's been a pleasure.
Thank you.
While Connecticut was shedding jobs by the hundreds of thousands, the cause of that economic crisis, COVID-19, was surging. A week after the first case was reported, 68 people tested positive. A week after that, 618. On the last day of March, the state of Connecticut said there were more than 3,100 confirmed cases of COVID-19. 608 people were hospitalized, and 69 people had died.
The hardest hit region was Fairfield County, due in part to its proximity to New York City. The virus was silently spreading in early March. The New York Times reported about a house party in Westport on March 5th, days before any cases were confirmed in the state. But that became what the paper called Party Zero. Roughly 50 people from all over the region and one person from South Africa came together to celebrate a birthday. Then they dispersed, went to their jobs in New York City, went to other parties, and went about their lives without knowing that some of them had and were spreading the coronavirus. By the time they got sick, it was too late. Kristen Hussey co-reported the story.
The reaction from people in the town as the news started coming out was fear. It was what you would see anywhere. Just no one knew enough about the virus to give definitive answers, and that's so frustrating.
As the surge continued and field hospital sites were stood up by National Guard troops, two separate realities of the pandemic emerged just in our small state. While there were more than 2,000 cases in Fairfield and New Haven counties, with nearly 500 hospitalizations at the end of March, the eastern part of the state at that point was still relatively untouched. In New London and Windham counties, there were just 38 confirmed cases and 8 hospitalizations. Hospitals in the hardest hit regions were under immense stress. Sarah Newman is a nurse manager at Yale New Haven Hospital, and she's been a nurse for nearly 40 years.
This is nothing like anything I've experienced. I lived through the AIDS crisis in the 80s in New York. We've had H1N1. I was here in the hospital for 9/11 waiting for ambulances to come from New York. We actually had a rule-out Ebola patient here at Yale New Haven, which we prepared for on the fly. But I've never seen anything like this.
That part of the state was getting hammered by the virus, and it was also spreading in other communities, especially nursing homes. The coronavirus preyed on Connecticut's most vulnerable citizens. Now, while it's known that the elderly and those in need of long-term care are at high risk of contracting respiratory illnesses, the degree of the devastation COVID-19 has wreaked on the state's nursing homes has been shocking to behold. Here to talk more about that is Connecticut Public Radio's Frankie Graziano. Frankie, of all the COVID-19 deaths statewide, more than half have been nursing home residents.
And if you factor in numbers from the Center of Medicare and Medicaid Services nationwide to state data, 10% of nursing home deaths due to COVID-19 in America happened in Connecticut. That's startling. And what's also startling about Connecticut's numbers is that data on infections and deaths shared by the Department of Public Health, they don't include staff contracting COVID-19 or dying from that. So who knows what the necessary numbers are, the real numbers of how many people are getting sick in nursing homes.
Just startling numbers. We've established now, of course, that nursing home residents represent an at-risk population. What else might explain why coronavirus has cut such a catastrophic swath across that population?
One thing I think, John Henry, we didn't know about early on was that the dreaded asymptomatic carrier may be to blame, penetrating a system that pretty much locked down immediately after the virus became a factor in the area. But I talked to Matthew Barrett, the president of a trade association that represents 145 nursing homes. He offered one thing the state could have done early on.
I think there has to be an evaluation about whether or not hospitals being overrun in Connecticut and across the country, as hard as it was to estimate it, and it's how well intended it was to get estimates on hospital surge, whether or not we overestimated that. And that led to more resources being put into that part of the system at the expense of nursing facilities downstream.
What about PPE, personal protective equipment? There was a massive shortage in the beginning of the pandemic that prompted some lawmakers to ask the president to federalize the supply chain. Now, how did this lack of PPE manifest itself in the nursing homes?
Here's an idea of what staff at these long-term care facilities have been going through. It comes from Zena Bennett. She's a CNA at St. Joseph's Manor in Trumbull.
A lot of times we're running out of gowns. Everybody in our building is not getting N95s. They're only being select about who they give it to.
Specifically on the shortage of gowns, John Henry, maybe the most seminal moment of the pandemic for nursing homes was when the state's largest healthcare workers union shared a photo of a worker wearing a trash bag in lieu of a protective gown. On an April media call, a Department of Public Health official, her name is Barbara Cass, said while she couldn't comment on specific photos,
we too have heard the stories and have followed up on the trash bag. And in many of those cases, in all of the cases thus far, that has been the preference of the employee. It has not been supported by the employer, but that's what they felt comfortable with doing.
That struck a nerve with reporters on the call and with the union. To be fair to Cass, she was recounting what she had been told. It's just representative of how hard PPE was to come by and how much scrutiny the DPH was under.
Wow. COVID-19 cases in Connecticut continue to dwindle. Naturally, people have the next uptick in the back of their minds, though, in a time that's still shrouded in a lot of uncertainty. Now, do you have some keys for what nursing homes need to do in anticipation of a potential coronavirus second wave?
Barrett told me, he's the president of the Association of Skilled Nursing Facilities. He says three things are important: increased testing, that's regular screening of residents and workers, an abundance of personal protective equipment made available to mitigate the workers' exposure, and staffing in general. Two things quickly, John Henry. Governor Ned Lamont recently ordered universal testing of staff in all Connecticut long-term care facilities. And two, regarding the staffing, the state created a temporary nurses' aid certification so that unlicensed workers could be hired to meet a potential staff shortage, provided they've got some training.
We could talk for much longer about this, Frankie, but we have to leave it here. Frankie Graziano on the impact of COVID-19 on nursing homes.
On Monday, after we spoke with Frankie, Governor Ned Lamont ordered an independent review of Connecticut assisted living facilities and nursing homes. Lamont says he wants an analysis of how the pandemic was addressed in these facilities. He says he wants this completed before the fall in case there's a second round of the virus. Now to talk more about some of the issues Frankie raised, we're pleased to bring in Rob Burrill, president of SEIU 1199 New England, which represents many of Connecticut's nursing home workers. Thanks for your time.
Of course, thank you.
We just heard a representative of the nursing home employers say that Connecticut put too much of its resources early on into helping hospitals build out their capacity. He says that not enough help was given at the start of the crisis to nursing homes. Do you agree with that?
I don't want to focus on statistics because behind each one of those figures is a human being. It's a life that has been lost. But if we look at over 2,000 fatalities in Connecticut nursing homes, over 10% of the resident population having lost their life over the past 3 months, those numbers really speak for themselves. Of course, acute care hospitals, places where people can go to be healed, needed to get the majority of the focus in terms of resources. But we knew that going into the pandemic that the elderly are particularly vulnerable, that people with underlying health conditions are an additional vulnerability, and that when you have a congregate care setting, that we could expect that there were going to be real challenges in nursing homes. So it's clear to me that the nursing homes were under-resourced. Ideally, what would you have liked to have seen? Number one is that the state should have been in touch with all parties and done the short, medium, and long-term planning necessary to get ahead of the curve. By the way, we've been putting out appeals to the state of Connecticut to engage in medium to long-term planning for months. No response, nothing. But that would have allowed us to say, what's the assessment in terms of personal protective equipment? In many cases, there was literally none. Okay, we had workers that were fashioning their own masks out of cloth, that were making protective gear as late as May out of trash bags, as late as May. Those were critical issues to make sure that the nursing homes were resourced. And then I would say the other big piece is that there should have been much greater concern paid to making sure that each nursing home had real infection control plans. That would be a critical piece. What about testing of both patients and staff? I mean, did things move along quickly enough, do you think? So some of this is there was a national shortage of available testing equipment. Okay, we know that. So if we know that there's a problem in terms of availability of testing, then what you got to resource people with protective gear. Now that the testing is starting to be implemented, the workers that test positive are going to have to be quarantined for up to 2 weeks at a time, obviously as a safety and precautionary measure. That's good. How are the facilities that are about to hit a hard stop on the funding increase on June 30th going to find the additional staff? What we were seeing in terms of the way that the state has dealt with this is a Medicaid resident population. 80 to 90% of the patients in nursing homes are Medicaid residents. So by definition, poor people with underlying health conditions, disproportionately Black and brown, the workforce overwhelmingly Black, brown, female, low income, okay? And it is time to have an honest discussion about the fact that part of the problem in terms of why the workforce has been neglected and consequently the patient population has been devastated by this illness is the demographics of both populations, low income, female, Black, brown, and working class white. And the suffering and the pain of this population has frankly been rendered invisible. Rob Burrill, really glad you could take some time to speak with us today. Thank you, Diane. Throughout this special, we are remembering some of the Connecticut residents who died from the coronavirus. Paulo Ferreira lost his only son, 26-year-old Jonathan Ferreira of Newington.
Jonathan was always a happy kid, is always with a smile in his face. He loved reading books. He used to spend most of his summers back in Portugal with our family. But Jonathan was working every day. He was 2 weeks in a row. So one day he came home and told us, "I'm so tired, I can't go back to work tomorrow." That same day, he started having fever. First week was kind of rough, but then the things were starting to improve and they started getting better. It was getting better and better. And one day, his blood pressure just completely dropped. They had nothing else they could do anymore. And if we wanted to say our goodbyes, they FaceTime. It looked so peaceful. So we were able to say our goodbyes to him. The nurses said that he could hear us talking to him.
You're listening to First Wave, Coronavirus in Connecticut. Coming up, how teachers, students, and their families have responded to their new reality of distance learning. We'll be back after this break.
This is First Wave, Coronavirus in Connecticut. I'm John Henry Smith.
And I'm Diane Orsen. The pandemic has upended all of our lives, particularly a whole generation of school students. They were abruptly sent home in mid-March and after a lot of uncertainty finished out the school year online. That was hard for many kids, those for whom school is the only stable environment they have, those who had no laptops and no internet to be able to complete classes, and those who had other family responsibilities.
My dad, he works 3 jobs, and both my parents don't speak fluent English. So I have to really take care of my little sister, who's only 6. So not only do I have to do my own work, but I also have to take care of her at the same time. And on top of that, I have to juggle with also working.
That's Mumthanu Emila. She's a junior at Naugatuck High School. An English teacher at that school, Megan Sherry, says she's very aware of the challenges her students face.
It's really important for us to think about our students as people. And when we have kids who are waiting in line at a food bank or working 40 hours a week or worried about a sick family member when they don't have health insurance, we can't expect them to care about William Shakespeare. You have to think about, what can I provide them that will make this time in their life easier or will make them learn something that's applicable to this experience.
Perhaps the most disappointing moments came for high school seniors who faced this loss of school community at the end of their K-12 experience, with all of the traditions and friendships they had to miss out on. We spoke to 2 graduating seniors to get their thoughts on this year.
Hi, I'm Ashley Pitter. I go to Hartford Public High School.
My name is Omar Small. I went to Hartford Public High.
I was really excited. I was pumped for everything because I had senior friends before and they went through all the things. And I wish I was a part of that. And then I was just hoping, it's coming. And then it didn't. And then my heart just broke.
I expected to have the full senior experience, hanging with my classmates, possibly going to prom. I missed out on so many activities, which really kind of hurt.
I thought I would have this memory to look back on for a lifetime. I spent my last moment with my friends celebrating, a happy feeling. But instead, I'm going to look back at that I was stuck in the house. I was angry that I didn't get the normal graduation.
I just cannot learn online anymore. I thought it would have been fun to learn online in the beginning, but, as time went on, it got boring. It got lacking of human interaction.
Google Classroom experience was the worst for me. I'm a visual learner. I need my teacher to be right in front of me, talking to me. So they posted their notes and stuff, and I had to read it and teach myself. It was harder than being in the classroom.
This quarantine, it's sad. It may have brought some of us together, but it also tore some of us apart.
I only really wish I got to do a senior prank. I look forward to that because all my years at school, I've seen seniors before me do pranks. And I was just waiting for my turn, and I was waiting for senior skip day. I just wish it was different.
Ashley Pitter and Omar Small will receive their high school diplomas at a drive-through graduation ceremony in a parking lot in Hartford this Friday. Both are going on to study at UConn in the fall.
We've been remembering some of the people we've lost in the pandemic. Here is Sandra Tate Eady remembering her friend, 80-year-old Loretta Headley of Bloomfield.
The first time we met, I just remember this bubbly and fun and friendly and warm woman who danced all night. And you could tell she really enjoyed celebration. She just ministered in food. She just loved to cook and she loved to feed people. And so when you would go to her house, you were usually going expecting to eat. And not only during the holidays, anytime you needed a pick-me-up, you could drop by. She loved seeing people because she lived alone. And you can be sure that she could go into her freezer and just pull out something and whip you up a plate. She grew up in Barbados, and she grew up in a small parish called St. Peter. So coming to America and, starting as a dietary aide, and with that salary, being able to purchase their own home and provide for her children, that meant a lot. And she was very proud of what she was able to accomplish.
That's Sandra Tate Eady remembering Loretta Headley of Bloomfield. You're listening to First Wave, Coronavirus in Connecticut. I'm Diane Orsen. Coming up next hour, we'll continue to look back at this state's handling of the pandemic, including the racial disparities and how the pandemic intersected with the protests around the death of George Floyd last month. We'll also hear from Governor Lamont, who reflects on how his administration handled the state's response. This is Connecticut Public Radio.
This is First Wave, Coronavirus in Connecticut. I'm John Henry Smith.
And I'm Diane Orsen. We're looking back at the first 3 months of the COVID-19 pandemic in our state, where we've been, the response the state took, and what we've learned along the way. You can see our visual reporting on this time period at ctpublic.org/firstwave.
After more than a month of closures and sheltering in place for those of us who could, the state was reaching the first wave's peak. One of the key metrics that Governor Lamont was watching was COVID-19 related hospitalizations. Those topped out at nearly 2,000 in the middle of April. Since that time, the number of hospitalizations has steadily declined to around 300 today. As those numbers started to drop, attention turned to a phased reopening of the state.
That does not mean some guy's hanging up the mission accomplished banner. What it does mean is if you guys stay disciplined, focus on what we got to do, make sure you wear the mask. I think we're going to turn the corner on May 20th, and we'll be able to get through this summer together as a state.
May 20th was when Phase 1 began. It allowed for the reopening of retail, offices, outdoor recreation, and outdoor dining, but all required social distancing measures like tables outside at least 6 feet apart.
One restaurant that reopened that day was the Country Diner in Enfield. Manager Carrie Pimvongsa got to see some of her regular customers again after being closed for 2 months.
It's been amazing to see them, amazing to know that they're okay, because the whole time we're closed, we don't know if they're okay. We don't know if they're sick or, if they lost any loved one.
One of those regulars was Robert Kleiman, who enjoyed an omelet.
This is a real treat to be able to come and get food out from this restaurant.
The Country Diner was one of the lucky ones. Some restaurants closed permanently as a result of the pandemic, including Firebox in Hartford and Gino Ariema's restaurant in Stores. Another industry that was initially scheduled to reopen on May 20th was hair salons. But there was some pushback. Allison Valsamis owns a studio in Shelton and started a Facebook group advocating for a delay.
I have received hundreds and hundreds of messages and emails from stylists across the state of Connecticut that were very fearful of returning to work and also were being threatened with termination from their employers if they did not report to work on May 20th.
Just 2 days before the scheduled reopening, Lamont conceded and ordered hair salons and barbershops to remain closed until June 1st. But some hairdressers declared they were still ready to get back to work, most notably Kat Thibodeau in Pawcatuck. She reopened anyway on March 20th.
It's honestly been a really dark time, and now I've had to completely turn my business on its head, but I'm willing to do anything I can not to lose it.
Her shop was eventually forced to shut down again. Phase 2 of the reopen plan is scheduled for June 17th, and it will allow amusement parks, libraries, bowling alleys, movie theaters, and gyms, among other places, to reopen. Again, all with social distancing restrictions. That's when restaurants will also be able to start serving people indoors. Although it appears as though life is returning to normal, the pandemic isn't over.
State epidemiologist Dr. Matthew Carter declined an interview request for this program. In an email, he warned that although our case numbers are declining, we are still in the first wave of the pandemic.
We might have thought at this point that no other news story could push the pandemic out of the headlines. But we were wrong.
Across the country today, some attended peaceful vigils, marches, and demonstrations, while others spent the day sweeping up broken glass, trash, and other debris from protests over the death of George Floyd in police custody.
Just as states began to reopen, the shocking police killing of George Floyd in Minneapolis on Memorial Day galvanized a huge wave of protests, one that's still going on, and which still only seems to be growing.
As we think about the racial disparities of the pandemic, it seems to have many points of intersection with the disparities that people of color have faced here for hundreds of years. We asked some of the protesters who have taken to Connecticut streets, why do they feel it's so important to protest, even potentially risking their health to do so in the midst of a pandemic?
The future is more important to me than getting sick. I myself, I'm not immunocompromised, but there are people in my house who are, and if I have to isolate myself in my home after this, I will do that.
Look, me as a black man, they're killing us for no reason. So if I die from the police brutality or COVID, I have 2 little girls to go home to. I want to go home, end of the day.
Protesters need to be able to go out and practice their constitutional rights, but they need to do it safely. And we have taken care of patients with COVID-19, and we've seen what it can do to people, and we've seen that black and brown communities have been more impacted by that. So we said, well, we need to use our voices as doctors to give masks to folks.
There's another epidemic that's happening in this country. The coronavirus has just got here, but inequality for black Americans, have been here for 400 years. That's the epidemic we're trying to stop.
You heard the voices of Dane Bell, Alan Johnson, Dr. Sumit Kumar, and Nebeyu Masresha at protests in New Haven and New London.
It's certainly true that the coronavirus pandemic has had a particularly harsh impact on communities of color. The disease outbreak adds to existing layers of racial disparities and health outcomes that can be traced to ongoing systemic racism. Advocates now call for more resources to better support these residents and workers going forward. Here's our health reporter, Nicole Leonard.
Outbreaks in other parts of the world told us that COVID-19 would likely infect and kill thousands of people in the United States. And at that point, Connecticut health experts were already predicting that the virus would disproportionately impact Black and Hispanic residents.
People who are public health researchers from day one wanted the information about socioeconomic factors, about race, ethnicity, when we saw all of the data.
That's Dr. Julia Rosenberg, a New Haven pediatrician specializing in immigrant and underserved populations.
The reason is it's not a surprise that we see disparities when it comes to nearly any health condition. And in a pandemic, we're seeing that as well.
State data now makes clear that months into this pandemic, Black and Hispanic residents are significantly more likely than white residents to contract the virus. And Black residents are more than twice as likely to die.
To this to be the most powerful country in the world, it is weak.
Union activist Catherine John from New Haven came out for a May Day rally last month. People were demanding better pandemic protections for workers.
These things are wrong. It should not have taken COVID for us to say, let's respect the Black, brown, and immigrant workers.
Employees at grocery stores, in transportation, in the service industry, and at nursing homes have largely been on the front lines, in positions that increase their risk of getting COVID-19. A significant portion of these workers are Black and brown. Takesha Dewan Everett is the executive director of Health Equity CT.
If we are not building our systems to take care of those who are taking care of us, then who's going to do it? Who is going to be our retail worker? The retail worker that I engage with every single time I go to the store is a person of color. Who's going to be the nurse at the nursing home who's taking care of your parents when they're in a nursing home?
Experts say many of the racial disparities in COVID-19 outcomes are also part of a long line of consequences that come from hundreds of years of medical mistreatment and the disenfranchisement of Black people. Wisdom Powell, director of the Health Disparities Institute at UConn, says that's led to rational and rooted mistrust in the healthcare system and its response to the pandemic.
So when we look at communities of color and we say, well, we're building the testing, why aren't they coming? They aren't coming because we have not actually done the work to restore trust
While drive-through testing sites went up relatively quickly, it took several weeks for hospital systems to roll out COVID testing that reached into communities of color in a significant way. Recently, Hartford Healthcare held a mobile testing event in Hartford's North End, a predominantly Black and brown neighborhood. To make the event successful, the health system partnered with legislators who lived there, churches, and local organizations that were already part of the community. More than 300 people turned out. Denise Best is president of Voices of Women of Color, and she implored people to take precautions.
This is real. The fact that Black and brown people are infected and dying at higher rates than others is real. Everyone here knows somebody who died. My brother died.
Best says the COVID-19 epidemic has taken many lives, and the epidemic of racism continues to take them as well.
Black lives haven't mattered since we got off the slave ships. They've been picking us off one by one. Rest in peace, George Floyd. COVID-19 will do the job quickly and in large numbers. So get woke.
Powell says the simultaneous events of the pandemic and violent acts of racism intensify mental and behavioral health issues, especially among Black residents.
The pandemic itself can be a traumatizing event, which can compound existing trauma in communities. And when you can have that trauma sort of there, lodged in your spirit, brain, and body, and then you turn on the television and you see the repeated cycle of Black and brown people being subjected to racialized violence during the pandemic, you also can experience vicarious trauma.
There's a greater focus now on how to better support and protect communities of color during this disease outbreak and as we rebuild. State Senator Gary Winfield represents New Haven and West Haven.
If we simply recover, all that we've done is to not only leave in place the structures that existed, but further concretize them, make them harder, make them more difficult to overcome. Because there's a gap that has been created by the response we have between communities that are being responded to in ways that are useful, helpful, and communities that are not.
Public health experts and legislators agree that as the state moves forward beyond the peak of the pandemic, more Black, Hispanic, Native American, Asian, and other people of color need to be directly included in response plans, and that ensuring these communities get adequate protective gear, testing opportunities, primary and mental health care, as well as social and economic support will be a good step toward managing the pandemic in an equitable way.
To talk through some of the issues raised by the impact of the coronavirus on communities of color, we're joined now by Dr. Cato Lorenzen. He's a university professor and an orthopedic surgeon at the University of Connecticut School of Medicine. He's also done extensive research on racial disparities, including a study specifically about COVID-19. Doctor, I saw the results of a study from you and your colleagues that concluded Black people statewide as of April 1st had a higher rate of infection and death from COVID-19 in comparison to their population percentage. Now, that study, again, was done very early in the pandemic. Do you feel the results are still representative as to where we are now?
Well, yes. We actually published the first peer-reviewed study on COVID-19 in Blacks, actually in the country. And it really was prompted by what we saw on the internet, where there were questions as to whether Blacks actually were immune to COVID-19, which we thought was really dangerous to even place that on the internet. But in many places it was, and so we performed the first study. And what we found in the initial study, what that in terms of both numbers of cases and rates and also death rates. Were higher in Blacks per 100,000. That's been borne out, and that's actually subsequently it's been borne out not only in Connecticut but across the country. If we examine the totality of the data that's available, Blacks in the country make up about 13% of the population in America, and 25% of the deaths from coronavirus.
When this whole thing started, did you have a suspicion, was it already clear to you that this would hit communities of color harder?
Well, we did, and the reason was that there's obviously a long history of racism and discrimination in the country that persists now, and that history has made a big difference in the lives of black people and the health of black people, and placing them at the crosshairs of any type of new disease or certainly a pandemic.
Well, let's broaden that question in terms of the general impacts of racism on the health of those who are being discriminated against. What do you see in your research?
Racism has a number of different ways in which it impacts health. We know that there's a concept of allostatic load, or the wear and tear that one has in terms of living, and that racism has effects in terms of increasing this allostatic load in black individuals. And that increase in allostatic load contributes to disease, contributes to rates of infection, complications from infection. There are papers that have described neurodegenerative disorders that are exacerbated by racism, and also even metastatic cancer. At the same time, we published a paper on COVID-19. Perhaps a bit prophetically, we also published a paper the month before on racial profiling, and specifically that racial profiling is a public health and health disparities issues, and examine the ways in which racial profiling impacts the health of black people. And some of it's obviously, very straightforward in terms of blacks that are killed by police, but it's also a lot more nuanced. And for instance, one study showed that blacks who witness or see that an unarmed black person is killed by police actually have increased risks of having mental health referrals.
How do you feel the pandemic intersects with the events post the police killing of George Floyd in Minnesota?
We are experiencing in America a double pandemic. And that double pandemic is racism and COVID-19. And we're seeing the interplay of those effects. And we see that interplay of effects in terms of COVID-19, reflected in the high rates of blacks with disease and blacks dying of COVID-19. But we're also seeing these issues of racism are not subtle and they're not nuanced. And I think that part of America has had a bit of a disbelief about racism and naming racism and describing racism. One of the things that's happened, I think, because of the things that have happened in the last few weeks or so, is that at this point, I think that no one can claim that racism doesn't exist or racism is mild or we can overcome this easily. I think that because of the events that have taken place, it's very, very clear that racism is a huge problem in this country, and that we need to address it head on.
Today, we're remembering some of the people who died from COVID-19. Next, we'll hear from Lou Brown, talking about his brother, 79-year-old Clarence Otis Brown of Hartford.
He always thought he was the ladies' man, and most people who knew him knew his heart was good. In his later days, we tried to get him to go to the senior center. He would say to us, "I don't want to be around those old people." Young at heart. That's another good description of my brother Clarence. He was a kind, gentle soul. But the majority of people who knew him loved him. And he became everybody's friend. That was Clarence. Oh, that is Clarence in my heart, please. Nothing but smiles for the guy. That rascal Clarence Otis Brown. Whew.
That was Lou Brown, remembering his brother Clarence Otis Brown, who died of COVID-19.
When we come back, we'll continue to analyze the response to the coronavirus pandemic. This is First Wave, Coronavirus in Connecticut.
This is First Wave, Coronavirus in Connecticut. I'm Diane Orson.
And I'm John Henry Smith. Prisons and jails are breeding grounds for infectious diseases such as the coronavirus. The inability to quarantine or practice social distancing puts inmates at greater risk. Since the pandemic hit, correctional facilities around the country have emerged as hotspots for the virus. Mitigating the spread has proven to be a challenge in many facilities, including here in Connecticut. Joining us now on the show is Connecticut Public Radio's Lori Mack. Lori, where does the fight to stop the spread of coronavirus among Connecticut's prison population stand right now? What are the latest figures and how do we compare to other states?
More than 870 inmates and 380 staff members tested positive for COVID-19. 7 inmates have died. Now, that's according to numbers that the DOC put out on June 2nd. They're no longer updating those numbers on a daily basis. Now, the Marshall Project started keeping account of infections and deaths in state and federal prisons around the country, beginning in mid-March. I talked to Tom Mayer. He's one of the editors, and he told me Connecticut prisons have had a high rate of infection.
Connecticut is in that sort of top cohort. You know, it has the 6th highest infection rate in the country, and it's the 7th highest death rate. So it has really been affected by this considerably.
The number of infected inmates is likely higher. We know at this point that not everyone has been tested.
There have been a couple of lawsuits and a call for early releases. What has the response been, and where do those lawsuits stand?
So the big news here is that Sunday it was announced that the federal class action lawsuit, which was filed by the ACLU of Connecticut, settled. They filed lawsuits on the state and federal levels seeking protections for inmates from COVID in April. The agreement, which is pending the court's approval, requires the Department of Correction to prioritize elderly and medically vulnerable people for early release programs, provide certain sanitation practices, and other protections. If approved, it would also resolve that state lawsuit. But let's go back for a second and look at when this all started. Shortly after the first inmate tested positive, family members and advocates started demanding that the state release inmates. DOC did start to release inmates. I'm going to play a clip here of DOC Commissioner Rollin Cook saying that the release was being handled thoughtfully.
We have our entire reentry unit working on the complexities involved with leaving a prison during a pandemic to ensure that they have appropriate supports. We will not approve discretionary release for anyone under my statutory authority without a home plan.
The ACLU of Connecticut was pushing for more comprehensive releases, and that's when they filed those 2 lawsuits.
You know, several frontline prison employees spoke out a few weeks ago saying they were frustrated over the DOC's handling of the COVID-19 crisis. Now, what were some of their issues?
Several correction officers, supervisors, and nurses described a range of issues, including staff shortages, inadequate supplies of personal protective equipment, and a lack of social distancing among inmates. They reported that inmates were angry and accusing staff members of bringing the virus inside the prisons and jails. One nurse, Gabby Bettino, she's a nurse at Osborne Correctional Institution, said they were battling a staffing shortage long before the pandemic started. Osborne has also had the most cases and the most deaths.
We are working with an estimated 20 vacant nursing positions at Osborne. Shots are being called by administration, not including any medical direction. Inside the facility, movements are happening. It's a perfect storm.
The DOC did respond to those complaints. They issued a statement after that press conference acknowledging that early in the pandemic, some obstacles, such as the availability of PPE, were beyond the agency's control. Since then, the department says it's gone above and beyond federal guidelines and has also put in place additional staff where it could. Within days after the DOC workers called that press conference, the 7th inmate died. Pressures at that point were intensifying. Lamont was at a press conference in New Haven when he was confronted by prison rights advocate Barbara Fair.
People are dying. These people have families. They're hurting. And you sit in your house and you don't even care that these people are dying. You don't have a plan.
Only people getting out of prison are the people who are going to get out anyway.
Wow, very powerful words.
Yeah, so the Department of Correction has been under a lot of pressure to release more inmates. As of June 2nd, the Department of Corrections offender population stood at around 10,400, a number they claim is the lowest in more than 29 years. But the big development here now is the settlement in the federal lawsuit.
Lori Mack, thanks. This is First Wave, Coronavirus in Connecticut. I'm John Henry Smith.
And I'm Diane Orson. It's become a refrain among public health professionals in recent weeks. COVID-19 testing is a bridge to an eventual vaccine. But in Connecticut, that bridge is still being built. And for weeks, when the state was experiencing some of the worst effects of a global pandemic, testing in Connecticut was slow to grow and hard to access. Connecticut Public Radio's Patrick Scahill has been following the issue of COVID-19 testing and joins us now. Hi, Patrick.
Hi, Dan.
So there are two main types of COVID tests. Can you explain this?
Yes, so viral tests and antibody tests. And we'll start with the viral tests. These are also sometimes called PCR tests. These are the ones with the swabs. And right now, these are the most reliable tests. They will tell you if you have a current infection. Antibody tests, on the other hand, are done through a blood sample, and they will tell you if you had a previous infection. But the science on those tests, those antibody tests, is still emerging about how accurate they are, and it's also an open question if having antibodies can actually protect you from getting reinfected, or how long that protection might actually last.
Let's take a moment here and look back. It was 3 months ago when Governor Ned Lamont declared public health and civil preparedness emergencies because of COVID-19. Was testing happening back then?
It was virtually non-existent at that point. And part of the reason why, Dan, was that getting those nasal swabs was actually really, really hard. In the past, if you had flu-like symptoms, you'd go to your doctor and they would test you. But COVID-19, if you remember, was presenting those same symptoms. So all of a sudden, doctors' offices are telling patients that, no, you can't come in, stay home. Emergency rooms don't want contamination, so they're saying the same thing. So there's this scramble among public health professionals to basically spin up all of these isolated testing spots, right? Meanwhile, there's also a run on swabs, which are used in these testing kits. Everyone's scrambling to get those, so supply chain issues are popping up. Lab capacity at this point is not there to actually process these tests. It's just not built out yet. So results were taking days. And while all this is happening, infections and deaths, unfortunately, were growing across Connecticut.
Now, just a few days after Lamont's emergency declarations, the first person died of COVID-19 in an elder care facility. What was being said about testing at nursing homes back then?
So on that, here's Renee Coleman-Mitchell. She's the former commissioner of the State Department of Public Health. She's speaking here on March 18th.
There will be procedures, an assessment that will be done to decide whether we need to test all of the residents or not.
And so hindsight is always 20/20, but it's become readily apparent that congregate settings like nursing homes and assisted living facilities were really some of the most consequential places to do regular testing. You could also put prisons in that category as well. Here we are now in June. The state is now getting to a place where nursing home residents and staff, which is also very important, are getting tested on a regular basis. But the consequences of that delay nationwide have been really a public health disaster. Here in Connecticut, nursing homes and assisted living facilities account for roughly 70% of the state's more than 4,000 COVID deaths, and that's about 2,900 people, Diane.
So can you explain how more testing helps?
Well, more testing basically means public health officials have a better handle on the virus, right? So where it is, who has it. Recall, these tests are free. You typically do not need a doctor's note to get tested. You don't need insurance. And Governor Ned Lamont has said testing will be critical as the state slowly gets back to work. Here he is on May 12th, about a week before the Phase 1 reopening date.
This is going to give you the confidence that we have this virus more or less under control. At least we can see what's going on there as a bridge. The testing is a bridge to the vaccine.
By the end of June, Lamont says he wants the state conducting well over 100,000 weekly COVID-19 tests. But the state still has a lot of work to do. Connecticut averaged about 7,000 daily tests the first week of June. That's a rate that it will need to double in the coming weeks.
So who should get a test? If I'm not showing symptoms, should I be tested?
So that's kind of been the question, right? It really depends on who you ask. Here's Hartford Mayor Luke Bronin speaking on May 28th.
We want everybody to get tested in these weeks ahead. There's nothing to be afraid of. There's no reason not to get tested. And if you've got family members at home who you love, if you've got elderly in your life, if you've got anybody you're near, if you're working, if you're just going out to the grocery store, get tested because it's not just about you.
New Haven Mayor Justin Elicker has also called for more expansive testing of city residents, but the Lamont administration hasn't been so clear about it. Reporters have been asking for weeks if asymptomatic people, folks who don't have symptoms, should go out and get a test. And the administration response has been, if you have symptoms, even mild ones, do it, get tested. And while the governor's office has said repeatedly that it wants to prioritize testing in congregate care settings like nursing homes and in high-density, low-resource areas like some city neighborhoods, it has stopped short over and over again of telling asymptomatic people to go get tested. All that said, recently the state has had more tests than people are using. A few days ago, I spoke with Nathaniel Raymond. He's a lecturer at Yale University and is helping to coordinate the COVID-19 response in New Haven. He says everyone should go get a test if the capacity is there.
It's not only about you finding out your COVID status, it's also about you're supporting the science in real time. As we get more and more testing data in, we're learning what works and what doesn't work in virus control. You're helping us get from assumptions to evidence. Get tested.
So in the weeks ahead, he says public health officials need to push for more deliberate testing of vulnerable populations, but also push for a certain degree of randomization in their tests to ensure that the results are reflecting the actual spread of coronavirus and hopefully helping to avert a major second wave.
Okay, Patrick, thanks for your reporting.
Thanks, Dan.
Throughout this special, we've been remembering just some of those we've lost from the coronavirus in Connecticut. Amanda Thiessen remembers her grandmother, 92-year-old Rita Noonan of Waterbury.
My grandfather passed away 15 years ago. It was really surreal when he passed away because there was never any Rita without Ray. Every part of her life was connected to him. They just really had a really beautiful love. So after he passed away, it was really interesting because I really didn't think she would make it that long. I just didn't think she would be able to hold on. But it's incredible to me that she managed 15 years without him. And I think the most comforting part of all of this for me is the idea that they're reunited and continuing their love story on another plane, wherever that is.
That's Amanda Thiessen, remembering Rita Noonan of Waterbury. She died from COVID-19 at the age of 92.
When we come back from our break, we'll look back at the start of this pandemic with Governor Ned Lamont and later epidemiologist Greg Gonsalves. This is First Wave, Coronavirus in Connecticut.
This is First Wave, Coronavirus in Connecticut. I'm John Henry Smith.
And I'm Diane Orson. As we wrap up this special, we're going to hear from noted Yale epidemiologist Greg Gonsalves.
But first, no state had a playbook for how to deal with this pandemic. From testing and contact tracing strategies to plans to reopen, every state has handled it differently.
There are still many unknowns about this disease, including confusion from the World Health Organization just this week about the role of asymptomatic carriers. At the end of last week, I spoke to Governor Ned Lamont to look back at the decisions he made and the lessons we've learned so far. Governor Ned Lamont, thanks for joining us.
Nice to be with you.
Early on, you said that Connecticut was prepared. Do you still think that Connecticut was prepared for the pandemic?
No. Nobody was prepared for the pandemic. We didn't have the supply of PPE, which is mainly the protective gowns and masks. And there was no stockpile down in Washington, D.C. Saying help is on the way. Here comes the cavalry. Never happened. I'll say our hospitals had capacity. Our hospitals had enough PPE. I think they primarily were able to provide that to everybody in need. And I got tired of sitting around waiting for Washington. So we worked with some of our business leaders, went and got the biggest acquisition of protective masks and gowns and thermometers, anywhere in the region.
Can you talk about the relationship between Connecticut and the states and the federal government?
Schizophrenic. I'd say we had some fairly constructive meetings with Vice President Pence's task force, Fauci, Birx, thoughtful, constructive people who are trying to do the right thing. Obviously, they were very slow off the draw. I give a shout out to my fellow governors, way ahead of the curve compared to the federal government. But that said, they came on board and were constructive. They were sometimes contradicted by the President of the United States, who sent out a very different message that complicated what we governors are trying to do.
Early on, public health experts warned that the coronavirus could hit certain populations especially hard, and that has proven true. So briefly, what did your administration do early on to protect older adults, especially those in nursing homes?
Nursing homes have been the tragedy of this. Obviously, over 60% of our deaths are related to nursing homes, and I think that's true across the country. The very first thing we did very early was no visitation. That was really tough because that meant you can't go see grandma. And I heard a lot about that. Second thing we did do was go in and do a lot of testing early. Was that very successful, Diane? No, it really wasn't. You know why? Because we would test somebody who was symptomatic, which meant they would probably already had been infecting people for a few days. Then I sent it to some lab in California. Then 4 days later, 30 more people have already been infected in the nursing home. So that we all could have done a lot better on.
I want to turn now to personnel. They say personnel is policy. And I wonder if you could reflect on whether you believe you've had the right people in place. You had some new staff at the start of this. You removed Renee Coleman Mitchell as Commissioner of the Department of Public Health. What are your thoughts looking back?
One of the first things we want to do when you talk about personnel is not think that we had all the answers or the legislature had all the answers, state employees had all the answers. So I went to the leading epidemiologists and infectious disease healthcare professionals in the state and all over the country, so I could have a strong scientific basis to what we had to do. I got folks from the business community there, not big business, but small business, the restaurant association, retail association. From there, in terms of our immediate team here in the state government, Josh Jabal, who has a healthcare or life sciences background, I should say, took the lead. We worked with our hospitals. The hospitals hadn't even talked to each other for quite a while, and hadn't even talked to Connecticut, the state, going back a couple of years. And we had them working together as one. We were totally interfaced.
But I do want to ask you about Renee Coleman Mitchell and the role of the Department of Public Health during this pandemic. It hasn't been that visible.
Well, I think early on, I saw public health, shame on me, is doing public outreach and embracing these communities and talking about what you can do in terms of public health for your communities and yourself. And Diane, let's face it, in the last 6 months, that job has changed dramatically. They're doing track and trace. They're rolling out the testing protocols. So I brought in Deirdre Gifford, who ran Department of Social Services.
Can you specifically address the question of why you decided to remove Renee Coleman Mitchell from her position?
The job changed.
Okay, let's move on. It's been a critical time for gubernatorial leadership. Each governor in the country has handled things a little bit differently. Connecticut's had the third most deaths per 100,000 of any state in the country after New York and New Jersey, the sixth most number of cases per 100,000. What should Connecticut residents take away from these figures?
I'd say a couple things. The epicenter of the COVID crisis was the greater New York metro area. And so obviously Southern Connecticut, New York City, parts of New Jersey were hit harder than any place else in the country. We fortunately had enough capacity in our hospitals to make sure that everybody got treatment that needed the treatment going forward. I think more broadly in terms of fatalities, Diane, there's going to be a lot of interesting documentation on that over the course of the next period of time. I'll tell you what I mean by that. We say if it's a COVID-related fatality, if you had symptoms even though you weren't tested, we're going to call this a COVID fatality. So our spike in terms of fatalities are related to our spike in terms of COVID. Other states have had different definitions, but that's a complicated way of saying we lost too many people, especially in our nursing homes, especially those that are oldest.
What do you wish you'd done differently?
Everything a month earlier. I wish if it was in January and I was looking at Wuhan, I had the foresight to contract for PPE in China before anybody else did. I guess closing down the nursing homes a little bit earlier. But you can only lead if people want to follow. I mean, when we said, or when the Sports Association said no to high school championships, this is basketball back in March, I think it was. We had thousands of people in petitions and hundreds of people protesting and said, what are you doing? And then a week later, the NBA shut down the season and people sort of said, okay, now I know what you're doing.
Well, we'll have to end it there. Governor Lamont, thanks so much for your time.
Thanks, Diane. Nice to see you.
As we close out this radio special, we want to widen the lens and get a dispassionate assessment of the first 3 months of the pandemic from a man who has both a historical and a scientific perspective on the crisis. Greg Gonsalves is an epidemiologist at Yale University. He also was an activist on the front lines of the AIDS epidemic 30 years ago. Greg, how do you compare what the country experienced in 1980 to what we've seen so far in the coronavirus pandemic?
In the 1980s, we had an epidemic that began far away, but ended up on our shores and was allowed to sort of run its course for months and months, years and years, because there was a government in Washington, D.C. that didn't care about the people who were mostly afflicted by it, largely gay men, people who use drugs, people of color, the poor. Now we're all these years later, and there's a virus spreading around the world again from a faraway place, but is here on our shores, is devastating many more communities than back in the early days of the AIDS epidemic. But we still have a government that dragged its feet, said the epidemic would go away, that we didn't need that many tests, we were doing well, we were doing fine, and at any point it's all up to the states to handle this. Two botched epidemics separated by decades apart, but with lots of dead bodies at the feet of our national and state leaders.
Those disproportionately affected by AIDS are also being disproportionately affected by COVID-19. I don't think I'm saying anything controversial by that. What do these numbers tell us about the overall racial disparities in society?
So one is, when people think about the AIDS epidemic in the United States, they often have the face of a gay white man. But really, HIV is hitting communities of color, particularly young African-American men, heterosexual men, or gay men in the rural South. Look at COVID-19. The racial disparities in terms of who lives and who dies from COVID-19 are very much the same. It doesn't break down on lines of sexuality, but it certainly breaks down on lines of race. And the number of African Americans and Latinos filling up the rosters of the dead are far higher than the number of their white counterparts when you normalize by population. And so this isn't surprising to me. If you look at the map of the density of slaves in the slave states around the time before the Civil War, and you look at the life expectancy, in the 2000s, the maps could overlay on each other. We have a long, long history in this country of health disparities going back probably for centuries.
We've all heard the saying, those who don't know history are doomed to repeat it. What lessons from the AIDS crisis have we doomed ourselves with by repeating?
In March and April, I kept hoping and praying that our federal government would get its act together. I mean, countries as small as New Zealand, places like Hong Kong, Singapore, South Korea, all seem to be able to sort of seize the moment and tackle this virus in a way that's made both their economic devastation and their human devastation much, much, much less. But in March and April, I kept hoping. And by May and June, I'm hoping against hope because the cavalry is not coming.
Give us, if you will, an overview of Connecticut's numbers in this crisis in terms of hospitalizations and deaths specifically. Our death rate seems comparatively high among states. Does that mean that we in Connecticut went wrong in our response?
Remember where we live. Nobody in Connecticut, including me, wants to hear this, but we're a colony of New York. We're a satellite of New York. And so what happened in New York City, decisions made by Governor Cuomo and Mayor Bill de Blasio, in particular, to sort of delay social distancing and sort of the lockdown in the city, let the virus sort of flourish for several weeks longer than it needed to in Manhattan and Queens and Brooklyn, Bronx and Staten Island. And we were on the commuter line, right? And if you look at Fairfield County in Connecticut, it's been hardest hit. And it's not because there's something different about Fairfield County than New Haven County. It's just that in a certain sense, it's part of the New York metro area, and infections from New York City basically made their way through commuters and people go back and forth to the city to our state. And so we've had a rough time here, but I think some of it's about our geography. I think the state has been actually pretty good on everything except sort of dealing with the incarcerated population in the state and some of the vulnerable groups I've spoken about, like people who use drugs. The state, did a lockdown fairly quickly and, keeping people at home and shutting the schools. And so I think in terms of if we were going to compare ourselves to other states around the country and in the region, I think we did pretty well. I think we just had some accidents of history and geography that made it more difficult for us here in terms of the numbers we see and so on.
As you look around at what's going on socially in the country with all of the protests, all of the people in the streets, all of the social distancing not being observed, would you say a second wave is something you expect?
So I think everybody's been talking about a second wave of the epidemic just because we've let the virus seed itself from north to south, east to west in this country. And it's now becoming, I think, what we'd call an infectious disease endemic. It's no longer an epidemic. It's starting to sort of leach into the fabric of our sort of microbial life in this country. We've seen protests, but more importantly, we've seen sort of a decision by all 50 states to relax their social distancing requirements. Extreme situations in prisons and jails and meatpacking plants where people are packed in like sardines that are rife for viral replication happening as you and I speak. And so all the features we need to see a second wave happening sooner rather than later are already there. It was a great weekend here in New Haven, and as I walked around the city, I could see people, in parks, outdoors, trying to maintain some social distancing. But it's clear this isn't March or April, and I think what we're going to see sooner rather than later is a filling up of hospital rooms, ICUs, people on ventilators again. And the second time around, I think it's going to be very, very difficult to get people to do what they did the first time, which is to stay home if they can.
That was Greg Gonsalves, an epidemiologist at Yale University and a Connecticut resident.
As much as our world has changed since the start of the coronavirus pandemic, we'd like to return to where we started, by the numbers. It's only been 94 days since the first confirmed case of COVID-19. As Greg Gonsalves reminds us, the AIDS crisis began nearly 40 years ago. Over those 4 decades, a lot has been learned about AIDS, but it didn't happen overnight.
We also know we will be studying the coronavirus for years, if not decades to come. Some of what you've heard over the last 2 hours will likely be dated by next week or even in the next few hours.
But as the news unfolds and we learn more, Connecticut Public Radio will continue our commitment to report on the impact the coronavirus has on our community. First Wave was written and produced by Tucker Ives and edited by Harriet Jones.
Reporting for the show came from Frankie Graziano, Ray Hartman, Nicole Leonard, Ryan Lindsay, Lori Mack, and Patrick Scahill, with contributions from Carmen Baskoff, Ryan Martins, and the staff of Connecticut Public Radio.
The remembrances were recorded by Kyone Wolf. Our news director is Jeff Cohen, and our senior director of storytelling and radio programming is Katie Tolarski. You can see visual reporting on the first wave of the coronavirus pandemic in Connecticut at ctpublic.org/firstwave. I'm Diane Orsen.
And I'm John Henry Smith. This is Connecticut Public Radio.